Good morning, everyone. It is Friday, November 20th. We have just released our updated numbers and new cases for today here in Nunavut. Premier will speak briefly about that and give a breakdown of where those are. Dr. Patterson is going to talk briefly about contact tracing. We've gotten some questions around that. We will do the normal one question, one follow-up. We're going to start on this side of the room. Thanks.
November 20. Tako no ta khatsiu lang mga tanalo na taw sa malang may matata ko sibilak tiyo kaw sa kilang ayangit luta Patterson no kaw sa kalang ayo katiyaw si mayo ni kaw sa pala anak mo ang maluta makko apek kutiyaw lang mayo makko na to sa katalote
Nunavut miru blaku chapa pe ubla me pi ako ubla me pi yut na hautin Nunavut mi luan ni kolid tun ami hung ora tu takwan nuban na yo ali atau arveni pinga hut tikarami ma arveni lead 6 kangasinami mana Nunavut luan ni takwa katiluk ta sugi nuban na yo akatut 84 ngulakto amatakwa nuban na yo akat mga ta kawi hak taw nikut mamalik taw nikut 4,293 amatakwa huli malik taw yo kawi hak taw yo inuit Nunavut luan nuban na yo akangi mata 892 mahanaw yo hanat teli ataw hipa no kangalarap ta ukwat khimalasuta Nunavut luani Nunavut mi malitsa ko pagkatakwa pekoyaw unit malitsa ko tigo tana nuban na yo nakigli or no kayu luarap tigo tana nuban na yo na hokotik kangito pilere yo aropta hudloang kupta takagupta kinaw mangapta tana kinamea mun akta ta ho matana numan na yo ko malitsa la go malako yo yut kanigi lo tangin luta ublaluk tangin luta niuvera khang na opta ang ko tabunak khangin luwe ataw hit na indo yo mi niuvera talo ni ta ko malitsa la go agabu ang mi charta luwe tana numan na yo nunap tinut tikilang iman ubaluba tikin na pat ang iglilang iman kau jema yung atakwa atoko yawa ayong naktu yui upenga atulaw megap tigo taw kihani malit cha la la wetana nuwan na yo nokkayu lo aptigo amata nokka ilata ublalo khoi tangitu amma kating angil ta kihani takwa nunu me kawi mat cha na mata aner tu lo tu makai tu lo tu he akal tu lo tu he amma nunamut Nunamo pe nunamo malohi kata kwa igloya me khatiti ta kwa ngin no pata katin no with indukanano unga higi lohi katin galuang lohi amma tan taw qatiya la fi nunamo mute anigo pikina pamitalo me atolo hinu wera opi ubaluba huname ame pileria to wita kwa inung nit ami huni katin na rowen mana yo kawi mayu ayo nak yo takwa nutak kanulo yo takwa nutak kawut ang tabut ilangin ni takut tangilas tuti pakan nangini ilin nangi ma tuti ta na ublumi nutak kanu ublo yo man takwa nutak na ta mat na paka kawi magamana na la ho matata ang yo kangin ni ata changin ana changin na galu takwa ublo yo lek ma ublo binutak kanu takwa nutak abut upigilaw lewut perok tilaw lewut en kawi ma yung atakwa taw akho sutitan nuban na yo mit nokkay ko ila nokkay ni lokataw matataw tak nutakat na la to hakta ki coronavirus me kay na homatatakwa kawi ma yung takat na en upigiwak en kowegi wakatakwa nutakat na ikayong mata amma Nunavut miuluktano kaitikana wafi mamat na sohe tu hakti tau takamakwa mana iswa kai maritak Patterson pekoyangin atwa ko yang malik tau ko yang amatakwa Nunavut government tau atwa ko yang kowege yung mata ayong naktu yuwalo ki hen kawi mayutakwa akko suta pileres suta nokkaini lukkapigotana nuban na yo Nunavut iloni amatakwa Nunavut miuta ing mini menere lufta pekan na wut ilabu menere lugit Pigutigal atau hekit katigi lutatan nuban na yo haleginarap to mat now you him. Now the English version. Good morning. Today, Nunavut has 10 new cases of COVID-19. There is 1 new case in Iqaluit, 3 new cases in Well Cove, and 6 additional cases in Rankin Inlet. Nunavut now has a total of 84 cases of COVID-19. The total number of persons followed to date is 4,293, and there are 892 persons currently being followed. As we head into the first week of our lockdown, I am asking Nunavut Mute to stay strong and to stay focused. This virus does not care how hard you work and where you're working, or how bored or how tired we are. We do not get to relax for a single moment with what we're doing. Please do not give it a chance to take more of a hold in any of our communities. As much as I know it'll be hard, I remind you all, please do not visit or socialize outside of your household. By all means, go outside, go hunting, go fishing, go on the land, but keep your household if you can. Otherwise, keep your group small and within the 5-person gathering limits. As always, wear a mask outside your home, maintain strong distance, wash your hands, cough in your elbow, and clean surfaces regularly. I know our reality is hard right now, especially for our kids. Today is National Child Day, so I encourage everyone to celebrate our children and their spirits, their talents, and their gifts. Our kids are a big part of our lives and communities, and COVID is hard on them too. Let's try to take some time today to let the children around us know how special they are and how proud we are of the sacrifices they are making too. Kids, we are so proud of what you're doing. We hope things might be more normal sometime soon. Thank you, and you are all so brave. To everyone across this territory, thank you. I have heard almost nothing but positive encouragement and praise for one another and all the work everyone is doing. We can do this, and we can keep it up. I want Nunavut Mute to stay well, stay safe, and mostly to stay home. Thank you.
Skipping the first paragraph.
Okay.
Good morning. Today I would like to explain a bit about what it means when we say somebody has been identified as having had contact with COVID-19. The goal of contact tracing is to break transmission as soon as possible. When someone is diagnosed with COVID-19, we want to find out who they spent time with while they were infectious. These people are considered contacts and may be incubating or growing the virus. Symptoms may appear up to 14 days after the last contact with an infected individual. For people who have been exposed to COVID-19, it is critical that they isolate themselves during these 14 days regardless of test results. It's very common to be spreading the virus without realizing it, which may make other people sick. So if you have been told that you have had high-risk contact with COVID-19, you must isolate at home. This is the best way to avoid spreading the virus.
Ula sakut ulumi naluna yay kay nakamagamakan utuk yung mga kinatuinak naluna taw sa mayo kaktilugo kati si yuminiyo kaktilugo no kadyo nak 19 limik. Tukaga kakata kati yaw yuminang ni kaw yung sakpalian ang motaman na siyang mapalian ng anok kaktitaw kulugo kilami yung nakpakon. Kinatuinak naluna taw si matilugo no kadyo nak 19 ta si manigamnik. Kawi ko makata-kata, kinakune kati si simalaw mga ta, siyang maksigon na latilugin. Tako naluna tayo vato kati yamin uninik, Taakko katijaminiujut ima seammak palliatit sikunnangata Nuvadjoarnak taarsimalertillugin. Taakko hanuikutaharunnangata ullunik 14 kingullerpaami seammak biulaartillugu. Taakko seammak biusimayut ubbalu katisissimayu Nuvadjoarnak 19 limmik pimmariuvok anitteiligaaharninginnik ulluni 14nik qauyisaqutiuju hanuit nallianutuinaarsimayu miniugaluartillugin. Imeiga juttu teema seammak sikunnangata qauyimagatik Nuvadjoarnarmik teema asiminnik qanimmatit sikunnartutik. Uqaujaussimaguvi teema katijaussimayu miniulutik uluqaanartumiinnerni Nuvadjoarnak 19 taarunnanermut anitteiligaaxallarittu taangeqqassinni. Teema kaunerpaangumma seammartit sitteilinermi tamatuminga Nuvadjoarnarmik.
Part of the job of a contact tracer is to assess the chance that COVID-19 has spread between two people. We know that transmission is most likely when people are close together for long periods. The general rule of thumb is that transmission is more likely when two people are within 6 feet of each other for more than 10 minutes, which is why it is important to avoid gatherings and limit social interactions to those you live with. During the incubation period, the virus may be growing inside us and the tests may not find it. Isolating yourself when asked will help break transmission, protecting your friends, family, and community.
Ilanga tamanna pileriat sariyangit katisi yumini unik qawisak palliajiyujut qawisak lutik hanutigi Nuvadjoarnak 19 tamanna seamma palliasimamanga makko kati yumini utillugi. Qawimayugu tamanna seamma palliagunnanga tamakko hanigittumini utillugik ammalo akuniunersa hanigittumini utillugik. Taanna atuagauga juttuuq taakko seammak biugunnartut makko katinga yumini utillugik ammalo 6 feet tungaani hanigittumini utillugit 10 minutes nik. Taimai mapimmariuvu katinga yuni teiligiaqarnisi ammalo inuuqatigi katinga teiligiaqarningi angiqqamiu qatugittuaqutsio. Tamanna Nuvadjoarnak piroqpalliatillugu timiujumi qawisaqutikku qawiyaungituinnariaqarngat taimaima anitteiligaaqqartitauguvit tamanna searmartailihullugu sapummitsigunnaravit piqannariarnik ilagiyarnik nunaqqatigiyarnillu.
Even if you have not been in contact with COVID-19, there is still a lot that everyone can do to break transmission. Stay home if you are sick. Keep your social bubble small by limiting activities to small groups of the same people. Wash your hands, wear a mask, and watch your distance. On Wednesday, I mentioned the hard work of our rapid response and public health teams to respond to this outbreak. Today, I would like to extend my appreciation to our lab staff. They are putting in extraordinary hours and working through the night and into the early hours of the morning to get test results done. Their work is instrumental in our efforts to contain the virus. Thank you.
Katisi yuminiung Iqaluit Nuvadjoarnak 19 limmik taakko kikkulima qanuiliuqataugunnarngata searmartit sittailinarmu Nuvadjoarnak 19 mik. Angiqqarsimainaqattarlusi qanimagutsi inuuqatigi katiqattartasi qatsiinnautillugit tamakkualu inuuqatigi qatsiinnauqattarluti taakkuasainai katiqattartasi katiqattarlugit. Aggasi waasainnarlugit matuarsimainnarlusi ammalu qanitsalualingikkaluamangaatsi ujjersutsianginnarlusi. Pingatserminaluna uqalauqama taakku atseruut iqaqattarningini tuavernartulirinermu ikajoreaqattartut ammalu aannearbinni iqqanaayartut tamakkununga saarmarpallianingani kamayut ullumili taima huyaligumavunga taakkua qawiissarbinni aungersibinni iqqanaayartiit taakku ikaqqaqasaalunni iqqanaayaqattalingata unnuakkulluunniit ullaaraalukku tamakkua qawiissartaut siarunnarhullugin taakkua piliqiangi pimmarialuummata siarmartitsitseilitilluta Nuvadjoarnarmi quyannami.
Hi, Trevor Wright, Nunavut News. You guys urged cooperation with contact tracing investigators. Are there people who don't or won't cooperate with investigators? Or?
Trevor Wright, Nunavut News kunnik taakku ajauttuilauqatsi ikajutseaqujillusi tamakkua katijaminiujut ilangi kawi saktuno ikayut siya katangin mata.
That's occasionally a problem in all outbreaks and tracing communicable disease. A lot of it's just confusion about who they are and what they're doing, and just trying to clarify their role and what they're trying to do.
Taman nakaw ngiliruti uga yung kanutuin na siyang mapalya yung laktilogo tamakuning nga siyang maktawagun naktunig. Hawi kaswatuin na katang at akiku mga ta kanu ilirtumin yung mga talo ang malutukisit siya kaswaktuting.
Another question. Are you guys testing mainly contacts or community members within the wider community, I guess?
Tako kawi saktaw barlia yung katiyamin yung nunalinin na tako kawi saktaw yung asik kaningin kawi sang nilasi.
Right now, the first focus, at any time, the first focus is always on testing people who are symptomatic. Then people who are contacts are, if they don't develop symptoms, are tested at a couple of points during their 14 days after transmission has ended. And so far, we haven't done any of that mass testing or screening where we're looking at testing everybody. That hasn't happened.
Mana yuta na sivula pa to aga kay gatigo tamakko kanu iguti hakto ni kawi sak palle hatta nang mik katiyamin ni unirato yo galo ni man na kawi sak palle hatta ngitgo kisene makko at kawi sak taw hatta to ta ko 14 ullu na law tillugi kisene tamakko kawi sak taw ge tungitto suli man namo.
Ulla good. Tobi utoing CBC kunni titaqarpiq qawgama aperioi qoyolluni tema quviasuppiussaariraalermat parnautik taqaqsimavat qanuq ilagik tui katittunnarmanga quviasuppiulerpat taana kayusiinnarpat qanuittariaqarnarpita. I received a message asking what is the plan for family gathering at Christmas if this doesn't get any better, and if we are allowed to have family gatherings.
Right now, the hope is that the current orders will, for most communities, will only be in place for 2 weeks, and we'll be able to, when we're in a better spot, ease up on the measures. In communities that are having that have COVID-19 in the community at Christmas time, the gatherings will need to be kept very small.
Tamakko just sutsatu na hatta harnertu ang kami khatigi kati hatta harnertu galwat kisani litako ano nalinni Nunavut 19 talinni khatsin na uluti kisani kati hatta harnertu.
And I should have been more specific when I said very small, probably just households only.
Tamakko khatsin na gaham na kataktak nalunay ra kanarlugo ang kami khatigi kisani kati hatta harnertu.
I'm Megan Dooling with Nunavut News. What is driving these new cases if not community transmission?
Megan Dooling Nunavut ni tako sumami songo palle takkano nalinisa mapalle ngin naktaw tilugo.
Most of these new cases are household transmission. So we're able to follow the chain of transmission. We know how people were exposed and how it was brought in.
Tako ilun nati ilami sunak say Nunavut nakta palleyo illumi khatigi ni siya mapalleyo kawi sak palle gun nakatigo kanu siya mapalle mga amalo kanok katisisima yumini umangata.
Since the first cases appeared in Nunavut, have there been any people who tested positive as a result of them calling into the COVID hotline with symptoms, or have they all been as a result of your contact tracing?
Taman sibulak pa amin Nunavut minaluna ito yung kalaw tilugo Nunavut nakta simayunik. Tako naluna ito yung kalaw simabaw kalaw tiko kala yumini yunut ubalo tako kawi yaw simayo kisani kati yaw yuminak na kawi sa kanitsigo.
There have been a few people in Aviat who were first found through presentation with symptoms and were not initially part of any contact tracing. That's why we said there's community transmission happening there.
Thank you.
Tako ilang katsi na arveni kawi yaw si mayo. Kanu igut ikhalir ng ngata imakati si Jimini uningin ni kawi saktaw lautin na luni tay may mat. Arveni no nalin na sa mapalya si maninganin aluna si mayavo.
Emma Tranter, the Canadian Press. We're still announcing new cases every day, but we are seeing the numbers are lower than they have been. What does that tell you about containment at this point?
Emma Tranter, Canadian Press kunik tako tusak palya hatatavulu tamanutat katsin na palya yo ya alwak tilugit kano kausari kunak kikita man na kano sa mapalya nga kano yung mga.
It's too soon to read too much into that. We almost certainly have containment at this point in Savikataaq. The other communities, Rankin Inlet, Whale Cove, we might, but we're going to continue to be aggressively pursuing contact tracing and everything we need to do to ensure that we maintain or get containment. Aviat, it's concerning that there's whether or not there's still transmission happening, but again, we're acting as if there is, and we'll carry on to do that until things are better.
Manakila mi ulwak tu taman na nalo na tayo gasarlo ni kasi nilita ko sa mapalyagun ni ningin ni karon nakalwak tu kasi nikilwa mi kasi ni kang sinang mi tikirak chuang mi lo sulita man na at suruti gilari katigo katiya mi niyo ni kawisak palya ng mi taman na sa mapalya nga nukati tayo khulugo suli sumalom na nga siyang mapalya nga ni kisya ni tema siyang mapalya lakid ni nga tigot siyang mapalya lakid ni nga tigot suli ka magiyabo.
And because of the timing of testing, the variability of plane flights and all of those other factors, the numbers will go up and down from day to day regardless of what's happening in the community. If the pilot takes off, have to say they're weather delayed, and then we may not be able to get a number of samples until the next day. So you could literally go from 0 one day to a large number the next day just because of that.
Taman na hawi sak palya na kangako katam ni ngalo tamakwalo kangatayo ato ina katam ni ngilo. Tako hatsi ning yami songo katalang ayo hatsi na ko katarlo tilo nunalin ne kano ili alwak kata. Surlo silang nilo mo ilang iking overreact tayo katang ata ilangan ni ulo may pitakangin na kay kunak tigo kaupa ko kalami songo kaya kanirlo titamakko pidyo tigilugi kangatayo tambalo silak nilo.
You mentioned that lab workers are working through the night to make sure these tests are completed. What's our capacity to deal with testing right now? Are we able to keep up with the number of people that are being tested?
Tako ako yan na may kawagabigyan yung sivin ni kawa yasakti yung katakto alaon na ako kanaya katalang ata piyon nakti katsa kita kanaya kong nakto ni kawa yasam ng mulo ang umatigong natsa kita suli.
Right now, it's sustainable for at least a little while longer. They are working very hard. If we start to need to test significantly higher numbers, we may have to shift some testing to flying it to the south to get for the samples to be analyzed in Winnipeg or somewhere else.
Mana yung ang umatigong naktugot kasi ni tamakko hangatuin nak ilan ang umatigong na iligop tayo kalunano arlak titsakat kaya katuin na kaya kalaktigo Winnipeg mo asingin nulo ni kalunano.
Jackie McKay, CBC News. To follow up on Megan's question, for household transmission, why aren't those people being sent to the spaces for isolation? And can you talk more about those separate isolation spaces, what the situation would be when they would be used?
Jackie McKay, CBC kunni Megan kutinga ilagay kan nalugo tako ang kami katigi sa mapalya titsa katigi matasumat tako awlak titaw siman ng mga tanak bilak minisa biyo minita man nakaw sa kan nakyo.
It's on a case-by-case basis and it varies from community to community depending upon the resources available. And a major factor is that for many of these individuals, by the time we know of them, the symptoms have already developed in maybe several days, and so that exposure has already happened. And so moving people out after that doesn't do a lot of good and may consume resources that we might need for other people. So it's a complicated decision.
Tako atu ni tartugi khawi sakpalle hatartavut ajigi hatangi mata malu nunalinnu tako atu ni khawi saktavalle hatartu tamako atu inauningi pidjutigillugit taima khawi jaw yu haktillugu taima kanu iguti hakpalle ligi hatanga tamalu se maksi juminiugi tutik taima imat angi qari jaw yuni anititsinne utatamannatu teharajangi mat taima sokati simangita wangi kami hatigi ilagi hatarunarningi.
Are we still able to use resources within the territory, or have you asked for outside help yet?
Sulita ko Nunavut me pelerijutit sani atut searun nakita balo sila tani ngatuni kayoktaw ko mas malaki.
We've had discussions, the minister, the premier, and some myself with different aspects of or different parts of the federal government. There's been a couple of small requests for assistance to relieve some staff and to get extra help. And there's been some other discussions about contingency planning.
Uhahatigit sumayugutan na lo minister lo sivulerti lo vangalo tamakwa lo uhahataw simaluti adjiging ito ni government hakuni pili review yut makko ni tutsiraw te harsimayugu pilo waktu me kanayak tinik kanayalo elektoni pedyo te harsuta sulita man na khawsari ballayabo.
Kent Driscoll, APTN National News. Dr. Patterson, if there's no positive cases on Baffin Island or in the Kitikmeot at the end of this 2 weeks, will schools and offices reopen like they were before?
Kent Driscoll, APTN kumnik luta Patterson tako nuva joanak to hangi pasuli kikitalo mekitirmeunilo tako makupin sa Rusi anigo katik tako ilinati kanayakti luterun naksilakan.
Yes, that's the plan. At the end of the 2-week period, any communities that do not have cases of COVID-19 will be able to go back to much less stringent public health measures.
Tema pamnasi mayugo tako nungwani makupin sa Rusi tako nunalit nuvajuang naktohangi pata taima utak palagun naksine apto tamako khasuyaw garum narlutaan na hamnangitulan na mamalita khuyaw.
You mentioned contingency plans, and one of the ones that's been discussed this week would be bringing in the military in a bad situation. What I'm wondering is, how bad would the situation need to get before you would want the armed forces, for example, to come up and help?
Yo khawsa khatarawit ima pamnaw te khara hamne mo khanit to khalam nekat tabani pinasa ako sa mga kausakak to kalaw nga unalit sa yakoy kayo kaya ako nang nakaktaw lutik. Kanutigi piyong iliktig kaya katak ko unataktik ko kaya kuyaw lang nga kayo kaya kuyaw lutik.
Basically, when our resources, including staff and other resources, medevac flights, any one of those or others, if they're overwhelmed and can no longer cope, then we would be looking for outside assistance. And so it's a really complicated question to answer because it could be that we just need help in one community. We could need help because we've got significant outbreaks in multiple communities. So I'm not trying to be cagey or anything. It's just that's the bottom line is when we're no longer able to cope.
Ima ikayok tau gaya karumal kayak tugu tamako pilirit jutit sabut amigalo alak na kata surle kanayak ti piyat sa kalo alak kata balo hangatayo ko to avang naktuko awlak ti sigun na ilin neruta tamako alo ila immini pilirigun na ilin neruta sila tani nga tuni kayok tau gaya makayak tugut Taannak kiukasuareanga nalunartuugaloa kisiani suurlu atausorminunallinni siarmartuqallarilerneqqat ilanginnilu amissuulutu siarmartuqalerneqqat kamagunnaillikuttanarmini teema kisiani silataaniingaartuni kajoqeartaugumaleriartugun.
Trevor Wright, Nunavut News. You mentioned a couple of small requests for help from the federal government. What kind of help?
Trevor Wright, Nunavut News kunni tutsarannaqataaraviangiyuungittuugaloani gavamatuqakkunni qanui kajoqtaugumanneqqin.
We've had discussions about an epidemiology support, so analysis of the numbers and establishing all of those links. We've had discussions about infection prevention and control support for some communities. And the other request is that we're having a discussion about is having an emergency liaison officer here in Iqaluit so that operational communication is smoother and easier.
Uqauseqarsimayugu tutsiqarsimayugu taikkuassiarmartulerinermu qauyimayitallariuyunik taikkuninga qauyisarunnartuni qatsiuninginni kammalunamutuaangammangaa tasiarmapallianiuyut. Uqauseqarsimayugu tamannasiarmapalliayulerinermu nuqqangatitsinermu ikajoqtaugumat simalluta ilanginni nunalinni tutsiqarsimammiyugu taima tuavernartukku tamaani tuttarpiugajartun mik iqalunni tusaamatitsijiugajartumit aulatauniujunu.
And there's been a lot of discussions for contingency planning and support in some of those other scenarios that we've mentioned earlier, but those other ones are the specific ones that I've been involved in.
Uqausiullaritsimammiyu tamakkuninga parnainermu qanuiliortuqallarilinneqqat pimmariulualerneqqat ubballu tamannasiarmapallialerneqqataakku aassingit taak tutsiqarsimayavun.
What's the difference between a critical and essential worker? I might have missed it, but what is it?
Qanutaakku ajigingin haqqat pimmariuyuni aseegurpiqangittuni qanayarti tikititauqattartut.
So essential workplaces are the workplaces or the work that needs to carry on even when we're in fairly stringent public health measures like what we're in right now.
Taakku aseegurpiqangittuni qanayarialiit iqqanayarbi matuyungagialiit maannauyor matusimagaluartilluta tuavernartukkuut aannaaqarnangittulerinermu tuavernartumiikkaluartilluta.
Critical workers are used in a different context, at least what we've been doing for the last 8 months, with providing exemptions for some people for the isolation hubs because they're in a job that there will be harm if it goes vacant or unfilled for 2 weeks.
For 2 weeks?
Yeah.
Taakku oli pimmariuyumni qanayaali tikititautsautigigum naqattartu inutuuvimmigiartungikainnaqattarlutik suurlu tamakkua iqqanayaaqangata imaakaungiliuruti qallarilerayanga taakku iqqanayaangi innuttaunningippa tamakkuuni pinasaaqusiinni.
Megan Dooling, Nunavut News. It's been 2 weeks since the first case of COVID-19 was announced. How do you know when those are recovered? How do you classify that?
Megan Dooling Nunatsakunnik makkuusimalangatip inasaaqusiik taakku Nunavut 19 taalaussimatillugit qanorliqauyimagajaqqitaakku qanuigunneeriangi.
It has to have been at least 10 days since either their symptoms started or the swab was collected, and their symptoms have to be completely resolved. Like they have to have been without a fever or significant cough for at least 24 hours.
Taakku ulluni hulinik naasimalerlutik qanuigutitaaqpalliayuminiuninganik uppaluqauyasartau laortillugit ima uuternalaurunniirlutik uppalu huirsuqattalaurunnniirlutik ullunik 24ning.
And so I'm assuming you'll announce when someone's classified as recovered.
Correct. And, oh,
Wait.
sorry.
Nalunayag sigayaki. Takwa kanu igunne kata.
That's correct. We'll announce it, and just so everyone's clear, when somebody gets to that point, they can no longer spread it, so they are perfectly safe to go back to work and other social activities.
Taman na suliyok nalunayag sigayak tigu takwa kanu igunne kata malok. Siang maksigun na ilipata ilas. Siang maksigun kata na igunne kata nalunayag ayak meyawa tamakwa kanu igunne ang nakaklugin o Joanaaq 19 takto mini.
I'm a transfer to the Canadian Press. How are you choosing to test people? Is it only people with symptoms or people who are considered contacts, or can anyone get tested at this point?
I'm a transfer Canadian Press gunne kanu ne ko kata kikik ko hawi sakta gunang mangata. Tako kanu iguti haktutuat ubalo katiya minituat ubalo kikutu na hawi sakta gunakan.
We're focusing on people who have symptoms or people who have known to have been contact or other high-risk concerns. If people feel that they need to be tested, they can call the hotline or their local health center.
Toga kataliman na sivulak pa mi tamakkuninga kanu iguti haktunik ubalo tamakkuninga katiya miniyunik uluga naktumin naksa pata hawi sakta katang mayut. Ubalo kinatuin na hawi sakta uga kalakit sugigune kala gunak tutabung akala viugunak tumurubalo hawi kautilune kala lunian na bingin.
But to be clear, especially in the communities that don't have any COVID-19, if somebody is at low risk of COVID and has no symptoms of COVID-19, we're very unlikely to recommend a test.
Kasi anito kisinatsiya kayo taman na kinatuin na tamakuna ni nunalid ni Panova Joanaaq 19 hangito ni uluga nak tumingin ni kasaguni kanuiguti hangin kunilu tamakko kayo saktaw jangit doon.
I think I asked this question a couple days ago, but I'm going to ask it again today. What can you tell us about why COVID-19 has spread so quickly into so many people in Arviat versus the other affected communities?
Napikilaw takalong ay patsani ulaw tapirikan nila nga sumali tamakko sa makalianak sa simabat Arviat ni asingin ni tayo may tuyatin naging.
We don't know all of that right now, and we may not know for quite some time when people can look at the patterns of transmission and understand those, what exactly happened.
Taman na kawya madyang itabu ako ni galak hanok taman na siya mapalya ng mga suli kawya saktaw laki kaya nga suli kawya mang itabu.
Jackie McKay, CBC News. Has anybody else been sent down south to be hospitalized?
Jackie McKay, CBC, kundi kasi kanya nga nakaluna na ulak titaw kaya kakasumaba.
For COVID-19? No.
Nubat Joanaaq 19 mitsano.
Great, my next question is for the Education Minister. With all kids out of school, how will the Department of Education decide which students receive devices from the government?
Receive what?
Devices.
Tamakko ilin natin nagi kanu nalo na sa katakisi nalle tamakko nga kakisaw ya kala katta ni mga ta.
Ko yun mi sivulpami ulumi Canada mi sugosi universitet ulogim mago tana nalo na kakamallogo malali sa kakamallogi sugosi kuloy mal universitet ulogat siya kullogi takwa kakasaw ya kalat tikisaka si mayabut takwa kutin naksanit turanga titawga ko mang naktut kupasin nila maka 11-12 daw tungwak takwa kasi sinakatsiya ko gatiwila tamang mi kisanit daw takwa 3,000 lugit tikisaka si majabu atok tayo na kulutigurin nakti bivilimanin. Thank you. Just to start off with recognizing National Child Day, I want all young children, boys and girls, to have a very wonderful day today. And to your question, we are in the process of prioritizing the devices for specifically on the higher grade ends, maybe looking at grade 11 and 12. We do want all students to get the best out of these devices, and with the limited 3,000 that we currently have on order and on hand, we'll maximize those to the best of our ability.
My question's also for Minister Joanasie. I'm wondering, what date do you expect the first of that online training to begin? When do you expect it to start?
Hanga dana hanga ulungani sibulak pa mi harisaw yakko ilin na palego nakstining ipigalaka.
Horin na me takwa dana HB ilin na ben pilariyo yun solo ilulok taw balderang man amaro takwa ilin na takotibutaw solo namminak kano lalo na ko taktak titaw hang nang matataw dana pinaswa ko si tinnamarag gaktuni ilokaktaw ballega hang natilugit atuktaw urna niakullugu takwa ilangi okalawatayla hakasaw jakala hang ningit ta sumanga atuk ballega urna sigalang mata kisanitaw imaka takwa 3,000 nirewilabut ilangi tikip ballega nang matataw takkiwalak tumi December mi amalo akgagono tamo tikillugu taykanitaw atulako mang naktu takunang nunaling ni The HB platform, we have our school staff have been activated and will continuing this work. This also involves having to activate our students and setting up accounts for them, and then this can also allow parents, after the students' account have been activated, for parents to log in and get connected that way. And of course, I've mentioned that for those students that have their personal devices at home currently, we ask that you can use it as soon as those activations have been actioned. Further to this, the 3,000 that we will have on hand, we anticipate our orders will start to roll in next month in December and through into the early new year. So those will be utilized at that time and specifically around those communities that are most impacted with COVID-19.
Minister Joanasie, your department has been talking about this EDSB program for months. Why isn't it ready now?
Minister Joanasie tana hapsi ilin ako tayo takkikasang nukausirilaktasi sumasulato inaw jangilla.
Tana solo pilimagsaktitaw si Mayugarat idisay jakotibut amaro tukisinang miyutaw ilang isoklo kakasawala ng mitaw pilimagsakan na roman si Mayut kisanitaw tana nagayugulutigo imaka takwa ilin niya bimipilagiliyo katawlut ataw tikoloti takwaro idisay di katudjakatigingitaw tukisimalutigo imaka pilimagsaw atun nakoygunang ningin ni tana nagayugituin naktabu. This has been planned quite over a long time, and having all our staff trained and familiar with the EDSB platform is an ongoing process, and this is where, again, we ask for patience, and we've tried to implement this training as best as we can, allowing for functionality, and knowing that too, that for example, the Teachers Association, we understand there's professional development that can be requested through their union, so that this might be an opportunity for training to continue onwards.
Unataw ilinniarpileriikkunnu toraangayuq taakkuat nutaqqat oqarseriiq sarilersimayassi taakkuat nutaqqat ikiaqqivik muut atturunnanngitsuni qanerli aturunnersiigayarpat qanerlu akilersurut riaqarayarluni I believe this was talked about before, but how will the internet be provided and will this be paid for?
Kujun me takwa ilangin kharimaduta oqaqsimagatta tamanilima ilinnertuqutilimma tiavut haqasauliqaraam ajoqatta tunigiaksa kisiani takwa maanna pisi ila tikisaaqasimalihu pisimajavullu ikiaqqavikkuurunnau teqarniartut ilagimmianga taanna. Just to clarify, yes, we do have the number of devices is smaller than the number of students that we have in the territory, but recognizing that the devices that we'll be purchasing and deploying to COVID-impacted communities, these include internet capabilities. Oqaqqallermilum ngaqaitakwa soorlupaippaaqutigut ilinniaqutiksanittau atuinnaqarbiuqattarunnarnaamata just to add on to the learning packages are the additional support and resource that students can access through their schools and their educators.
Megan Dooling, Nunatsiaq News. I have some questions for Dr. Patterson, please. I know that there are 84 people infected right now. Can you talk a little bit about the age and health of the people who have COVID-19 in Nunavut?
Megan Dooling Nunatsiaq ni hauya malaqattataako 84 nuvajoarnartaarsimayut uqausserigunnaqqigi ukiuqarmangata maloqanimmangata.
At the moment, they're all doing well and isolating at home. General other factors about their health, no, I can't talk about that. Age range is predominantly, from what I've seen, younger. Most are under 30.
Mana yoktaakwa anitteilititauju hanuigutaqangittua angeqqarsimallutik asinginni hanuigutinginni qaussaqarunnangittunga Kasani taako ukiuqaqajuttut iluunatigalak 30 tungaani ukiuliinuqajuarnartaarsimayu.
But before anybody reads too much into that, that's not based on an epidemiologic analysis of the data. That's my foggy recollection from getting the calls overnight. So.
Okay.
Tamanna sulituinnareahangimma naluneertauluattailili kis tamanna toqaangangimma searmarpalleajulerijillaqinno qauyisartausimagani unnuakku qaalaviuqqaama sulisinigalattillu.
The government of Canada is talking today. They're releasing some pretty dire predictions. I think 60,000 is the worst that they're projecting in the coming months. I'm wondering if Nunavut has modeling and projections, and are what they're predicting in southern Canada relevant to Nunavut?
Kamamakkungi kanata mitamakkuninga isumaalun nammarittunik suurlu 60,000 kannernik saqqirtuqarniarningani nuvatjuarnartulinni taqqigalauneartuni Nunavummiini qiugijaujuniing naluneersigasuarsimavat ubbaluuni tamakkua qallunaani niqiugijauju tamaunga toqaanganiqarunnaqqan.
No, we don't have the kind of modeling that they have in the south. We don't have the resources to do that. We had been in discussions on that, but just, excuse me, even just planning the model is taking quite a while, so we don't have it.
Aga manno yoqallunani taako qausiussimayuni tamaani pilirijjutitsaqangiluaqatta taima niriugunnarnammu hatsirirunnarninginnik kisaani qausiuqattapalliajuugalua tammalu parnai alla tamanna parnatauvallianinga kisunik hatsini niriugiyaqarmangaata akuniuju ajornarninganu.
In terms of the what happens in the south, obviously the higher the case rate or infection rate is in southern Canada, the more risk of having further events like this where it comes up even with isolation hubs.
Taakoli pidjutigillugi qanuiluuqqallianiuju amissorngupallianingi qallunaani attuuniqarunnarmangaata taako amissorngupalliatillugi qallunaani tamaanitta uluqianartumiinnersaugunnartugu alla inututit sikay nakattakalaqtilluta.
Thank you.
Emma Tranter, the Canadian Press. Can you explain the rationale for reducing grocery store hours? We've heard some complaints from communities that they're closing too early.
Emma Tranter, Canadian Press, kunni hausi karun na kipid yutingin nita ko ni wikpi nikita bit so may kakangay na kataos mamangata.
Yeah, it's something we're trying to fix. It was a request back in the spring. It was a request to close or limit the hours so that they had more time to clean and sanitize the building after hours. But obviously it doesn't work for everybody, so we'll get that fixed so that stores have the freedom to operate at the hours they need without increasing traffic too much.
Tamanna kigertaw galik tamanna tutsirautiu lausima maupengangutillugu tamakko ikaqangina katawgi akhullugi tay mapivitsaxatsia kanne khullugi salummarsay khattarnermut aniasimalaqtillugini uviraaqattaqtut taakko piviraqtitsia khugumagattiguni uvirbiraqtiuju tamakko nakatawluarsimatinagi ikaqangi matuingavigikunnartangi.